Sampognaro. I hold a master's in public health from Tulane, and I've worked in healthcare for 20 years. I would like to bring your attention to the document that was passed out. This is a request that I submitted to LDH. I requested a public records document for COVID-only deaths. These were deaths wherein the person, it was listed on the death certificate for COVID only, no comorbidities, no underlying conditions. So from the purported 17,200 plus COVID deaths that are currently listed on the LDH website, there were 803 COVID only deaths. COVID only, no comorbidities and no underlying conditions. This is a prime example why we need this resolution. What is going on with the other 16,000 plus? Are they people that died with COVID or from COVID? Because in April of 2020, the CDC and Dr. Birx announced on national TV that they were changing the method of completing a death certificate for COVID patients. Anyone who tested positive for COVID, regardless if that was their reason for their death, COVID was going to be placed on their death certificate. So we do need some sort of analysis. And since we are coming into an endemic part of this pandemic, where we're going to be dealing with COVID every year, we need to understand COVID. We need to understand and analyze our response to COVID. So of course we're going to make mistakes. I mean, we've never done this before. That's normal. But we need to just look at what we did and rectify any mistakes so we're not going in the wrong direction again. We're not repeating things that we could be doing better. We need to know, and we need to provide the high-risk population with mitigation measures, such as outpatient therapies of all types and lifestyle choices and changes. We know, for example, obesity is the #1 cause of severe COVID and death. I know that. My husband's an interventional cardiologist. These are his patients. We know this. But we also know obesity is controllable with lifestyle changes. Obesity also leads to hypertension, diabetes, heart disease. All these are also comorbidities for COVID. I ask that this resolution be passed favorably. We need this for the public to regain respect and trust for the public health in our state, and also for our healthcare facilities and our doctors. They don't trust anyone anymore. We also need to make sure that we don't repeat harmful measures such as lockdowns, testing and quarantining of healthy people. We've never done that. That's absolutely insane. Shutting down our small businesses and restricting our civil liberties. Thank you. I appreciate your time.
Thank you. Appreciate you three ladies.